increase the facial anatomy. And this is the finals. With the minimum occlusion, fabricated the chrome cover, and we cut it, trying to make this good margin. It's a little bit over each lap, and then this is the starting. Now it's finished the final framework. It's kind of a little bit more dilemma when we trying to set up the wax up. This is kind of behind the story, which is a great wax up setup, and we did not notify the here linger areas. The chimney is really tall. After we check the final frame design, so which is we corrected. It's increased a little bit differently by changing and try one more time from this and here, change it instead of the digital design, and we send it out to the doctors and patient. They can see together to make sure all the verified model. This is very imperative, otherwise we get crack or any problem in the future. This is a very important stage. And here is the really thick the bone here, and we're going to cover it up and let's make the little bit better contour, and especially the vice versa. Sometimes we have a little bit hygiene issue, and anyway, I have to make this better contour when patient smiling. That's the goal. So this one is SYTON 7-star case. Is make top of this, make individual crown restoration and the 3-unit bridge, and then make sure all the bite correctly done using the same articulator, the great articulator company. So let's make sure the embrasure is not thin, because if I make the thin, then we have a pass-up insertion problem. So make sure the proper embrasure and then fit it is much better. All right. He's finished the 24 teeth with the SYTON 7-star case, and basically we work with doctors Mouhannad Almajdalani in California, and then our goal trying to make the thin as possible, which is very thin. It's exceptionally thin. So made 2 chrome cover from hybrid milling machine from Autumn. So you can see the very thin in between both sides. Okay, facial and lingers, less than 7/10 millimeter, which is great. So we're going to make we made a very good, looks like the teeth less than 1 millimeter here. Just look at apical area, 9/10. That's good. Now, so after we made the fabrication jig in the wax trying several times, actually 2 times, because a little bit the problem is the bite, and then I don't want to show them the linger side implant here, which is the main issue. So I'm going to explain you later, and then you can see the one by one, just like drop it. And it looks like teeth is emergence profile, and then make it's a good anatomy. It's several different color variation from gingiva to all the way inside here. That's our art. It's not like, even though this is a monolithic, but we fabricate it is as great as possible. It just looks like natural teeth. And the lateral, the other side too. So match it up. Look at this. This one. You see? Yeah, just like drop it. So porcelain here, staining over there. No composite involved. I know people keep saying that there's composite here. No, ceramic is much better. Resistance to stain and plaque. So this is the best way to make that. So set up the lower 6-unit individual restoration. We're going to send it out to California, so we don't have to see this patient. That's why I made it 6-unit individual restorations here. I did not make the bridge. Whenever they come, patient from out of country or out of a state, and then I have to make in local, so I have to make the bridge work. It's much better at control. Anyway, that's the adaptations from the tissue. There, it's beautiful. So maxillary is done. Alright, now we ready to cementing. It's very imperative the cementing too. So side by side. I made the last video previously. You can see the 1 and the 2. Can you tell? So this is 2 is a different characteristic, and then size wise we matching the great passive fit. Right, so size is level 2. That's a 5-unit and 6-unit too. 6 singles restorations. Okay, so I'll show them this. That's great. And otherwise, other things is 3-unit monolithic bridge. Whenever they have a problem, the cracking is hardly I can get less than 3%, but they don't have, just prep a little bit so we can make the onlay type bridge just like this. So ceramic here, stain over there to make this exceptional aesthetics. So after cementations from the wax trying here and the final. You see our full processing about how to cement it and just make sure the wall in-centric bite. And so we solved the problems. This is here the backside has showing the implant, which is increase the facial anatomy. And this is the finals. And so we made from same articulations and made a soft cut like our 4mm thickness when they go to sleep. And make sure this. So our job is done. So now it's ready to send to California and make patients happy. Extremely thin and the highest aesthetics, and also as natural lifelike illustrations. So good. Now this is a grand final. So you see the tissue characteristic from the bottom and up higher. And the individual crown is the monolithic or special tissue between small, looks like lifelike illustrations. Looks like natural piece. It's finished the 24 piece.